motion be agreed to. The Honourable Annette King.
Thank you, Mr Speaker, and I rise to support, on behalf of the Labor opposition, the Health Practitioner Replacement of Statutory References to Medical Practitioners Bill. And I'm pleased it is going to the Health Select Committee. Where else would it go? A committee that is made up of some very good members and very well chaired by Simon O'Connor. So we look forward to having more work at that committee. We're underworked at this stage. What this bill does, as you've heard from the Minister, is amends a number of acts to increase the range of health professionals who are able to function at certain roles that are currently carried out by medical practitioners. And I want to begin by saying that I really welcome this change. It has been very, very long in the making. The first nurse practitioner was introduced into New Zealand in 2002, 13 years ago, and the reason I know that was I was the Minister of Health that brought in the first nurse practitioner. And what is a nurse practitioner, you might say out there in the listening public? It's a registered nurse practising at an advanced level in a specific role who has a master's level education and is recognised by the Nursing Council. We literally have thousands of nurses now with masterate level qualifications and above. And so back in 2002, it was very much part of what we as a Labor government wanted to do. And I'd just like to recall something that I said at that time. I said that nurses provide consistently high quality health care to New Zealanders, but there is considerable potential for them to contribute even more positively through responsive, innovative and collaborative health services. I said nurse practitioners will have an important responsibility in advocating health promotion and disease prevention, and part of their role will be to encourage self-care, but they also have the skills to consider a wide range of health services that may suit individual patients. I then went on to talk about the primary health care strategy, because diversifying our health workforce, a high quality workforce with a focus on better health for the whole population and reducing health inequalities was the very, very basis of the primary health care strategy. And fundamental to that was ensuring that people got the right services in the right place by the right practitioner. And so we have had for many years the ability for nurses to be able to carry out a role, a much more broadened role. On the 12th of September 2005, I actually announced the first prescribing rights for nurse practitioners. That is 10 years ago. And the Cabinet of the day, under the Helen Clark government, approved new regulations to allow nurse practitioners the ability to prescribe a range of prescription medicines and controlled substances. It took 6 years of work to get it to that position, and it allowed something like 100 nurse practitioners to start prescribing. Then there has been one big, long wait for anything else to happen. And so I note in the Cabinet paper I received from the Minister some time ago on this bill that it was back in October 2011 that the Cabinet did approve a number of changes to widen the health professionals who could undertake the functions that are currently carried out by medical practitioners. We are 5 years on, Mr Speaker, and this has not been concluded. The work has taken this long by this government. So important was it to have an extension of the role of health professionals that it's had to wait 5 years to be introduced today. You see, the rhetoric on health is all very well from the government, but the follow-up and the follow-through just does not match. The role of different health practitioners could enhance our ability to provide health services, particularly in rural and provincial New Zealand. Now, last week, my colleague David Clark and I visited all the small rural hospitals in the Otago and part of the Southland area. We went to Timaru, we went to Oamaru, Maniatoto, to Queenstown, to Clyde and to Clutha. And we spoke to those people who work there on the ground, heard firsthand what they said. And one of the things they need, desperately need, is a workforce suitable to provide the health services they need. They mentioned the need to have nurse practitioners able to carry out a wider range of services. Often hard to staff those areas with GPs, with doctors. Very hard at times to get the right staff in the right place. But a nurse practitioner with broadened skills, with the ability to carry out, prescribe and to carry out a range of functions, would enhance their ability to provide those health services. And one of the things the Minister said in his speech about this bill, he said the government wants services closer to home. Well, that is the very fundamental principle of the primary health care strategy. It's the fundamental principle of a good primary health service. Services closer to home. There would not be a member in this House that would not want their family to have services as close to home as possible for those that could be provided. And we could provide so much more in those communities with the right health workforce and commitment to real commitment to closer to home services. So what happened when we went to Queenstown? We got the example of how services closer to home by the right health professional is not happening. They have just seen 3 outpatient clinics in their town, a town of 30,000 that rises to 90,000 in the season, losing outpatient services in their town. And that's the kind of message we got where we went. The services aren't provided closer to home, often because the lack of a health workforce, often the lack of commitment, and often because the rhetoric does not match the action. And so I am delighted that now there's going to be a greater range of health professionals able to provide health services and able to prescribe. And I have to say again, it's taken far too long. We should not have waited this long if we really cared about providing those services to our communities. I then looked at the regulatory impact statement that was provided for this bill. And I note that it was done by the Ministry of Health, and one of the things that they did say in it was there was going to be no cost. There was going to be no cost to this. Well, I have to tell you, perhaps there's no additional cost to business in theory. But if we are really going to expand the role of nurse practitioners and other health professionals, there is a cost, because they cost more. You cannot pay a nurse practitioner who has masterate and higher qualifications, extra training, ability to prescribe, the same as you would pay a practice nurse. Unfortunately, the money that goes with a nurse practitioner has not flowed through to DHBs, and there are too few nurse practitioners in New Zealand right now. So there is a cost. And will that cost be picked up and provided for by the government in their health budget, or will they be told to take it out of the budget they've already got? And if that is the case, regardless of this extension to the role of nurse practitioners and other health professionals, there will be little that happens unless the money follows to pay for them. One other thing that is in the regulatory impact statement is around the consultation. And it said that overall the sector was in favour of the amendments that the Minister is making in this bill. They said it would improve efficiency, reduce some of the workload burden on doctors, and enable professionals to use their skills more. The submitters came from the nurses' organisation. They were very supportive of the change, and they've been supportive since 2002, very patient and waited a long time. But unfortunately, there were groups that opposed it. And unfortunately, I say again, the groups that opposed it were medical practitioners. And we have these old demarcations that still exist. If we are to have a fully operating primary health team, it's not a matter of who's got what, it's how you can give the best service to the patients that you are attending to. And that means using all the skills, the pharmacist skills, the nursing skills, the nurse practitioner skills, the skills that exist in a community to provide an excellent service to patients as close to home as possible. And so I still think we've got some battles to go through in terms of that old demarcation. We do support this bill. I see it's supposed to be passed by December. In the Health Select Committee, I can assure you the Labor opposition will be ensuring it is passed by December.
Good work. Good.
Simon O'Connor.
I'd like